good news is the largest COVID vaccine study to date was just released. 99 million people from around the world. It found that there is an extremely rare but increased risk for certain neurological, heart, blood, and brain disorders after taking the vaccine. But how rare is okay? And how much more is it now identified in people than before the vaccine? And also, what about all the long COVID symptoms that people are presenting? Why didn't they ask the 99 million about that? Those are all really good questions, right? You know how I know? They're not mine. They come from my doctor, double board certified physician, long COVID clinical specialist at Terrain Health, Dr. Robin Rose. So you called me about this and said, boy, the headline makes it sound like you got nothing to worry about. The opposite is true. Why?
So the background of the study is that they looked at, like you said, these 99 million people across 10 sites, 8 countries, and they identified these very significant problems that were neurologic, cardiac or hematologic issues. But these are problems that with any therapeutic or vaccine that is coming out, you wouldn't want to see these issues, right? Or you wouldn't expect to see these issues. And if you did, you'd want to see them at a low rate. And there were a handful that were flagged, as safety signals that were 2 to 3 times higher, when they looked at, they had the expected versus what the observed outcomes would be. And they were 2 to 3 times higher anyway.
So wait, what does that mean? What does expected versus observed mean?
So when you're rolling out, a therapeutic, a treatment, a vaccine, you expect maybe you'll have some side effects, mild, moderate, or severe side effects. So when they saw, when they were looking at the data, they knew that some of the side effects, that these serious side effects, the outcomes that were observed by the data collected by these 99 million people were higher than what they had expected. Does that make sense?
Mm. Yeah, and you told me that as an analogy, you were like, if we were talking about like cancers or things like that, people would not be happy about what they're seeing in this study. How so?
So this is what I mean. So when the headlines come out about vaccine, right, versus COVID, the vaccine, it's downplayed in a lot of ways, or the headlines downplay what's happening, okay? And the issue is that in our society and in healthcare in general, we always do care about the few or the rare things that happen, right? So, we colon cancer screen everyone that's 45 years and older, in the hundreds of thousands or millions of people that need to get screened because we're worried about the 32 out of every 100,000 people that get it per year, right? Same thing with women and cervical cancer, 7.7 females out of every 100,000 per year get cervical cancer. These are rarer, fewer events that occur, but we care about them. We don't downplay them, and we screen these people and we try to prevent it from happening. That was my point.
And here we're saying it's an acceptable loss. And you made another good point to me, which is, why didn't they, if they had this big cohort to work with, why didn't they ask them about a lot of other things that clinicians like you are seeing and see how prevalent they are? Well, what do you think the answer to your own question is?
Right. So exactly. There's tens of millions of people out there that are screaming from the rooftop saying that after they had the vaccine, they have suffered just basic symptoms, or not that basic, but not as severe as this, but symptoms that have impaired their activities of daily living. They can't live the way they used to live on a daily basis. And those are things including, chest heaviness, persistent headaches every day, brain fog, post-exertional malaise, neuropathy, weakness, new onset cardiac arrhythmias, structural heart damage, autoimmune conditions, all these different things. I can name 100 other things probably. Why are we not looking at those things? The things that we are looking at in this study particularly are things that are super rare and very, very serious and life-threatening.
Last thing, My producer just got in my ear, Ben, and said, hey, you know, the studies suggest that if you were vaccinated, you're less likely to get long COVID. Is that true in your experience?
In our personal experience, what we're seeing is that's a mixed bag. It's a mixed bag. We need a lot more data on that, but it seems that many patients that had long COVID that got vaccinated actually got worse instead of better, in my experience and in a lot of my colleagues' experience that are taking care of these patients across the country. So I think that really has to be looked at a little closer. And Chris, there was a study too that just came out about pregnant women last week. And when you look at that study, over 51% of the women that were pregnant that went on to have long COVID were vaccinated, and 49%. So there, it was a little bit more, you know, hedged more towards those patients were vaccinated and went on to long COVID versus not. So this is something that, again, is multifactorial. There's multiple things at play. People have had multiple vaccines and multiple exposures to the virus.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.